revise few of the aspects that you are required to have a review, and I would advise you to have an hands-on practice when we are in the primary healthcare settings, maybe on either of you guys. So for the chest, any patient, if you keep it in a scenario based, in the chest you will be having maybe a patient with asthma, maybe a patient with COPD, or you're suspecting the patient with asthma or COPD, or any other chest problem, maybe pneumonia or whatever. After you're taking the history, your relevant history taking aspects, after you're done with it, obviously you for the chest you are going to expose the chest to see the chest shape, chest wall. Are there any barrel shaped chest or not? Is there any deformity or not? If the adult is using his respiratory accessory respiratory muscles or not, and are there any other bulgings, or are there any tenderness in the chest wall? You have a comment on the inspection. Then when you have a comment on the inspection, after you're done with the inspection, you need to start with the auscultation and palpation. So in palpation, you can do palpation generally, and then you will do the percussions. You need to know all the nodes that are there for the percussions. So Vihu, can you come just for a minute? Yeah. Thank you. So for the chest, if the patient is a respiratory patient of any case, all right, you obviously need to have an inspection of the chest wall, barrel shaped and all that, and then you will do the generally palpation of all the chest. Are there any tenderness or costochondritis tenderness? So this is how you're going to palpate for that, and then you will do the percussions, all the areas, both the sides. So percussing all the areas, both the sides, from the apical to and bilaterally comparing both the sides for the percussion nodes. And obviously I'm not exposing it, but obviously first thing you need to do is the exposure of the whole chest wall. So for the percussion node, you will do apical percussions, you will do upper zone percussions, you will do middle zone percussions, lower zone percussions, lateral percussions, upper, middle and lower, comparing both the sides. And then from the back also, you will also need to do upper, middle and lower side percussions. So this is how you are going to percuss it. And then you will auscultate for, when you're doing auscultation, you also need to make sure that you compare both the sides, number one. Number second thing is you cover all the aspects, apical, upper, middle, lower, apical, upper, middle, lower, right, left. Same goes with the back. So this is for the auscultation, and also for the lateral sides also. So auscultating all the areas and commenting on all the areas of the added sounds, or bronchovesicular breathing or vesicular breathing or crepitations or wheezes. These all could be the signs of the chest examination.